Welcome to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. I'm really thankful that you're joining us as we go into some top topics facing our nation. Everything from the attacks on childcare and how we can fight back, to what's happening in schools, to vaccines, and to healthcare. We hear what's happening, how you can get involved, why your voice is still needed. Yes, it's still needed and still effective. We're going to jump right in with our first guest. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined by a nation-shaping, grassroots lifting, power rising person, Julie Kashen, who's with the Century Foundation. Welcome, Julie.
Thank you. I love that intro. That's amazing.
It's also accurate. You have written so many different pieces that are so important recently, and I want to start out talking about one. The Century Foundation and Caring Across Generations just released The Care Imperative, Why Investing in Care Grows America's Economy. I love the title. I couldn't agree more. It's a new report revealing how investing in the care economy provides a very clear path forward to a prosperous American future and economy. Can you share a little bit about that report? Details. We want details. We want the tea. What's the tea in that report?
Yeah, well, we looked at everything that we know is important to the care agenda. That's childcare, paid leave, paid sick days, aging and disability care, and investing in the care workforce. And looked at how each of those together makes a huge difference for the economy, both in what we currently measure and what we should measure. So does it add billions to the GDP? Yes. Does it boost productivity? Yes. Does it also reduce stress, burnout, and financial strain for families? Yes. Does it make life more affordable? Yes. So it kind of really cuts across both the typical economic engine that we look at and the family economic engine that is just as important in terms of family well-being.
One of the beautiful things about the care economy is, as you just said, it boosts families, it boosts the economy, it boosts businesses. And oftentimes we don't talk about how care policies, by the way, what are care policies? Paid family medical leave, childcare, access to home and community-based services, also healthcare. So those are care policies. So how do care policies also help businesses?
Well, we know a number of things. Number one, it's about the labor force, right? If you want everyone to be able to participate in the labor force and to really be present in their jobs and be productive, you need to support them as whole people. That includes the fact that they have children, that they have parents that need support, that they might have a spouse that's ill. That means that we need to make sure that everyone has these care needs met outside of their workplace so that they can be present inside their workplace.
Yeah, 100%. I mean, and when we're looking at things like paid sick days or earned sick days, because actually you earn your sick days through your time in at work, we see that, for example, presenteeism, when you have to go to work when you're sick, costs the economy a tremendous amount in billions of dollars a year. And when you think about it, it's obvious why. Like if you go to work and you have the flu, then everybody else at work also gets the flu. And then actually the productivity of the workplace goes down significantly because everybody's out sick. But if one person's out sick, then the productivity goes down just a little bit. Were there any unexpected data points that you found in the care imperative?
Well, I was going to say the flip side is also true, right? That as much as not having it causes issues, right? If we had it, say, for example, if we had paid family and medical leave policies, that would increase aggregate household income by $28 billion, right? That's including more spending in the economy. That means that women that, take it, that any parent that takes it, that any person that takes paid leave is also more likely to go back to work and be a part of the labor force. Same thing with childcare. We know that we lose $122 billion in the economy every year, not by not investing in childcare. That's a huge deal. That's everything from tax revenue to income that they would have to investing in childcare jobs and the fact that early educators would then be able to spend money in the economy as well. So we know that each of these policy issues has a huge financial impact.
And we also know that without care policies that people are pushed out of the labor force. So right now, the majority of families need the wages of moms to make ends meet. Newsflash, moms know this. Apparently, sometimes reporters and some elected leaders do not know this. I will say it again. The majority of families need the wages of moms to make ends meet. But if you don't have paid family medical leave when a new baby arrives, often you get pushed out of the labor force, out of a much needed job. If you don't have access to affordable childcare, often you get pushed out of the labor force, again, out of a much needed job. And the list goes on and on and on. Are there moments in the report that you also cover the fact that moms in particular are often pushed out of work because we don't have access to the care policies we need?
Yeah, absolutely. I mean, we know that moms, that women of color are the primary caregivers in most experiences, whether it's unpaid caregiving or paid caregiving. We know that the cost of unpaid caregiving in the United States is estimated to be over $1 trillion. And that doesn't account for the devaluation of the care workforce or the cost of those to those who need care, right? So this is trillion dollars with a T, not the number I normally use, right? With a T. That is impacting. And then we know, we don't have to tell moms, Kristen, because moms know just how much this affects them, right? It means that if you don't have a childcare slot, or if you lose your childcare slot because programs are closing, or if you can't afford a childcare slot because it's too expensive, what does that mean? Who's the one who's most likely to make the tough choice? That's the mom. She's going to reduce her hours, not take the promotion, not pursue her career that she has dreams of doing. She's going to have to, make these tough choices to be at home. Or families do tag team parenting where mom works at night, dad works during the day, and they never get to spend time together as a family. People are making these really tough choices that they shouldn't have to be making.
And most people know that they shouldn't have to be making this. That's why we're seeing candidates who are centering care winning, right? It doesn't have to be this way. I'm going to say it again. It doesn't have to be this way. Most other countries have passed a care infrastructure so that parents can go to work, kids can learn and thrive, caregivers, care workers can earn living wages, and we all win. Businesses also thrive as well. And before we dive into the candidates, what are the top care policies from your perspective, Julie?
Yeah, we need universal free childcare. We need paid family and medical leave for everyone. We need paid sick days for everyone. We need aging and disability care for everyone. And we need to make sure that those who are providing care, both the paid workforce and those who are doing it as unpaid caregivers, get what they should have in terms of dignity and respect. And certainly for the paid care workforce, that they are paid well with benefits and the ability to have a good life and save for retirement.
100%. Okay, so the candidates who spoke loudly and proudly about those care policies disproportionately won. They won, people. They won at disproportionate levels. And you just wrote an op-ed in Salon with Anna Wadia. And what was your take? What's the analysis? What's happening?
We saw that Democratic candidates won 3 high-profile races, in part by championing the care agenda and especially affordability around a care agenda, right? So in New York City, our mayor-elect Mamdani won his mayoral race on a bold vision of publicly funded childcare for every New Yorker. That's free, universal. We saw in New Jersey that, Governor-elect Cheryl won hers, a mom, and she championed Childcare for Every Community Act. And, all of these candidates won talking about an affordable care agenda.
What is giving you hope in this moment?
I think we are having a lot of, we have to reckon right now with a lot of despair. Let's just be honest about that, right? We have to hold on to that and be real about it. There's a lot to despair right now. People are being treated horribly. Immigrants are being treated horribly. Women are being treated horribly. There's so many things that are going on that are despicable. And we have to hold that alongside our hopefulness, right? And know that we actually are powerful enough to hold both of those things. So when I think about what's hopeful, it is the fact that we're seeing care policies really move. We have paid medical leave. We have paid sick days in states throughout the country. We have more and more states adopting universal free childcare. New Mexico, for the first time, as you've talked about on the show, right? We have these candidates running on care policies and winning. We have such attention to the fact that people can't afford their lives, that it's just too expensive, it's just too hard. But we're really shining a spotlight on that. And it's clear that people think it should be better. And we know it can be better. And so people are open to the ideas around how we're going to make that better.
What do you say to people, and I'm not saying I've heard from many people this week, but I might have heard from many people this week who have given up hope that change is possible, who have given up hope that we can vote, we can make phone calls, we can change who's in power, we can change the policies that are being considered. What do you say to people who have given up that kind of hope?
Yeah, Kristen, I would say two things. Number one, Valerie Kaur says that we are in darkness, but it's not the darkness of the tomb, it's the darkness of the womb. So we're getting ready to build something new, to birth something totally new and in a better world. So that's part one. And part two is that we do have to hold both. We have to hold the doom and gloom of the current moment with the possibility of a better future. We have to be in our moments of joy, right? Where we are just with our families, when we are together in community, when we're with our friends. We need to hold on to that laughter, to that fun, to that joy, and that will help us get through. And we need to look at how many courageous people there are right now. There's so many people standing up and doing the right thing right now. Every time we see ICE raids that are so horrific, we also see communities coming together to support those families, right? We see governors who are standing up and saying the right things and doing the right things and passing good laws. I think the best of humanity still exists. It just needs to keep getting louder.
Keep getting louder, keep persisting. Don't give up, you all. Speaking of that, do you have tips on how people can take action, how they can get louder, how they can persist?
Absolutely. I think people need to keep telling their own stories, right? We need to hear that it is not just my story, it is not just your story. It's all of us. We're all struggling with higher prices. We're all struggling with not being able to care for our families and do our work the same way we want to, because we don't have these solutions in place that we know would work, that work in other countries. We are all struggling. It is not just an individual issue, it is all of our issue. And the more we talk about it, the more we surface it. So I think that that's huge, to be telling those stories. And certainly continuing to engage with members of Congress, continuing to think about running for office yourself. So many more people are signing up to run for office and be a part of it. And also just being a part of collective care in your own community. Really figure out who's doing the work, who's there, who's showing up, and what's your role in that. I think being there and taking action really helps you feel better and do better.
100%. And actually, studies back that up. Taking action, staying involved actually increases happiness, you all, increases happiness. And we have the midterms coming soon. So be sure to keep calling your members of Congress. Tell them childcare for all now. Also tell them stop the cuts, reverse the cuts to healthcare. Oh my goodness, they need to reverse the cuts to healthcare. And make sure that you tell your friends to do the same. It's going to take all of us, and all of us together are unstoppable. I want to thank you, Julie Kashen, for all that you do, for writing about these policies, for investigating these policies, for developing proactive, positive policies that lift our country, and just for being on with us today. Thank you so much.
Thank you.
We're going to take a quick break, but stick around. We'll be right back with our next guest talking about how we can come together and protect our schools and why that's needed. We'll be back in a quick flash. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by MomsRising. We are joined by a very, 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 very wonderful guest today, Moira, Kaleida, who is with the Alliance to Reclaim Our Schools. Welcome, welcome, welcome.
Thank you so much for having me. Really happy to be here.
I'm so excited that you're here, because let us hear about the Alliance to Reclaim Our Schools, because hello, what's happening?
Hey, yeah. So the Alliance to Reclaim Our Schools is a national coalition of organizations made up of labor, family, legal support, all folks who support public education and are fighting for the schools our children deserve.
So needed. And for people who are just entering into the conversation about why a fight for the schools our children deserve is happening right now, can you share where are those fights happening? What's going on? Just a little summary. And when I say a little summary, I happen to know that there might be like 5 hours of attacks from the Trump administration on schools right now. So I don't even know how you do a summary, but what's your summary on why we are needed to fight for access to schools?
Yeah, absolutely. I mean, you covered it. There's a lot in general we could talk about around the dismantling of the Department of Education, the attempts to strip funding from core needed programs, including just, general Title I, and also IDEA. And so, right now our students have been under attack. And so we are seeing folks rise up in all 50 states, or in the US territories, everywhere, to say that these attacks cannot continue to happen, and especially to our most vulnerable students, the students who are constantly attacked, who have been, have had austerity budgets for years thrown at them, who have been discriminated against in schools. And how can we work to protect those students? And we know that when we fight together, we can win. And so we believe at Eros that, when we bring our partners in labor along with our community organizing partners and our parents, that we can really make a difference. And we could do that in so many ways.
One of the things you just brought up is the importance of fighting to protect IDEA. And I know people out there are like, IDEA, ooh, I like ideas. But what is IDEA?
Absolutely. So this year, actually, we just passed the 50th anniversary of this landmark law. IDEA is known as, excuse me, I apologize. IDEA is known as the Individuals with Disabilities Education Act. And that was an act established on November 29th of 1975 that granted students the right to a free and appropriate education, regardless of if they have a disability or if they don't, right? But this guaranteed the right for students with disabilities who were so often, like I said previously, excluded from our public education system prior to that. This granted them that access, those rights, and was supposed to grant some dollars as well. And we can talk about that shortly. But IDEA is under attack right now by the administration that's currently holding federal office. We have seen them attempt to and say that they wish to move the department back, which was never a thing, by the way, but they say they want to move it back to the Department of Health and Human Services, treating our kids more like they have something medically wrong with them rather than giving them the education they deserve. They have talked about block granting funds to states for IDEA, which could dismantle the entire way that we are able to support students and streamline that support, as well as who gets those dollars, right? What we know for sure is that students with disabilities only have the right to that free and appropriate education in their public school. So we demand that the IDEA not only just continue as is, but we need it fully funded to the way that it will actually make a bigger difference. Because without that money, what do we lose? We lose supports for our students. That means anything from adaptive equipment to adaptive technology to a paraprofessional in the classroom to a nurse. To a social worker, right? All of these are things that IDEA funds can support. And those don't just support kids with disabilities, they support all students. And so when we bring that system down and we break it down and we create more need with less help, then we're going to see even further destruction of our education system.
What can people do to help stop the destruction of our education system, which, by the way, people, is so important for our communities, for our kids, for our businesses, for our economy? I mean, it's just like ridiculously bad to destroy our education system. So what can people do to help keep our education system strong?
Yeah, that's a great question. So right now we are moving into action. We especially regarding IDEA, but also just regarding the appropriations bill that's out there right now that could get $12 billion out of our education system, right? But if you go to reclaimOurSchools.org and visit our Take Action page, you'll be able to download a toolkit. And that's what we're doing right now to really center the importance of this bill is we're celebrating it, right? Who said that resistance couldn't be joyful? So we are asking folks to go to their congressperson's office. It could be or your state or your senator. It could be your school board if that's not a feasible option for you, right? Go to the decision makers in your community and talk to them about the importance of IDEA and take a little cake, celebrate the birthday. Ask them, are you committed to preserving IDEA and expanding opportunities for our children? I think it should be an easy question, right? But we have it all laid out. We make it really simple for you, and you could jump in. And I can share a couple actions that folks are doing if you're interested in hearing a little
that.
bit more.
Also, do you have a website where people can go? I want to share a couple things. I want to hear the website. I want to hear it all.
Yes. Our website is reclaimOurSchools.org. And like I said, you can see a lot of these. If you're really ready to take action, you could jump onto that Take Action page where you can find all of these resources. But right now we have actions going in 8 states in December. So for anywhere from North Carolina visiting Senator Tillis to Maine visiting Susan Collins up in her office. We have folks gathering together. We have some people that have just done, a small group of 3 showing up and just, during office hours to just talk with a staff representative. And we have folks that are making sit-down meetings with their legislators and performing these actions. So I just want to give a shout out, North Carolina, Ohio, Columbus, Akron, Canton, lots of places in Ohio. I think there's 8 different legislative districts they're working there. In Michigan and New Hampshire, Senator Hassan, right? New York, Maine, Pennsylvania, where I am located. We are going to have some actions for some of our folks who have, been questionable on their support for public education. And we just want to ask them, where do you stand right now? And just last month, we had folks in Missouri who had an event as well. And we'd like to grow that list to be all 50 states and more, right? We see this is such a crucial time to fight for education and stand up. And if you want to learn how to go further and dig in more, we're here for that too.
Love it. Love it. Love it. Love it. Love the examples too. I'm getting a question a lot recently that I'm going to share with you. I suspect you have an awesome, spectacular, amazing answer. And that is, does it matter when we raise our voices? Does it matter when we visit our members of Congress with a cake that says IDEA on it? Does it matter when we don't give up? Does it?
It matters tremendously. These are the folks that we voted into office. You might not have voted, but we as a collective voted into office, right? And they need to hear our voices. We have been down in DC, walking the halls, talking to those legislators, catching them as they come out of meetings, right? We need to make our voices heard. When we have rallies, when we speak at school board meetings, when we go to the senator's office and we tell them what we believe in, they have no choice but to see our presence and to know that there is an army of folks that are ready to line up behind us if they aren't going to give us what we want. And all we're demanding is opportunity for our children in the schools that every child deserves. It shouldn't be hard for these folks, but let me tell you, when it came down to, for example, the federal voucher bill that was in the reconciliation package, this whole crew, right, our whole universe of groups that are fighting for education justice put so much pressure onto the legislators that were making that happen that we changed that bill where it was unlimited and for corporations before. We knocked it down, right? I'm not saying that we won the war, but we certainly won, I think, a battle within it, right there. And we have we have further to go, and we will do that. But we know that when we make noise, it actually matters. When funds were rescinded earlier this year, and not being released to school districts, we rose up, and you know what? We didn't rise up to the person in the White House. We rose up to our elected officials. And what did they do? We had 10 people, 10 Republicans, sign on to a letter demanding that those rescinded funds be released because of the importance of public schools serve in our communities.
I love that example. I'm like, give me that example. That is amazing. So knowing that, if you had somebody call you up and say, listen, the headlines are terrible. Listen, I just don't think I matter. What would you say to that person? And what would you tell them to do? Mind you, you can repeat your actions right now.
Thank you, Kristen. I would 100% tell that person to visit reclaimOurSchools.org. You don't have to start. If you're not ready to jump into action quite yet, we're here for you. We've got programs that can teach you how to build that community, we have partners on the ground who might have somebody that's building it right in your location that we can refer you to. We want to build this community. You are not one voice. You just haven't found your friends yet.
I love that you are not one voice. You just haven't found your friends yet. Oh, which gives me another question. How do people find their friends? Like a lot of people with COVID have literally forgotten how to people. I'm just going to call people a verb. Peopling has gotten harder after COVID. So like if people are like, hey, I'm feeling kind of isolated and this is like really hard. It is really hard and isolating, by the way, people. We want to verify your feelings. But what should they do to find people near them? We've got you. We're going to find you in terms of online, but how do people find people next door to create movement with?
Absolutely. I mean, so we have so many ways to connect, right? What COVID did was, isolate a lot of us, and those feelings are valid. But now is the time that, every month your school board has a meeting. There's going to be somebody else there that's interested in that. You can meet them there. You can meet them at your library. You can meet them at a meetup that if you just check on your local Mobilize or your local I'm forgetting the other service that we use next door. But find the people right in your community. Does your community have active PTA? What's happening at your school? Does your preschool near you need to volunteer? Does somebody need a lunch buddy? Like, find those little ways. What interests you, and how can you take that and put it into your community? Right? My sister loves art. She is an artist, and she has decided to do this by spending time after school doing work with kids, and spending that time volunteering with them. And so, how do you find that little way? Because with that, you're going to find other folks that are there and be able to connect and start to create and grow one by one that community. And I'll just say again, always look to your public school. There are so many great folks in there that are ready and willing to fight and might feel siloed and isolated too. But giving that little nod, wearing a shirt that says I support my teachers, can go a long way in starting to build those little communities that lead to this greater common good.
That is such excellent advice. I love it so much. It's so good. So everybody, please, A, don't give up. B, know that there is hope, and that the one thing we know that actually solves problems like the one we're facing right now is people power. So don't give up on yourself. Don't give up on other parents. Don't give up on other people. Don't give up on grandparents. Don't give up on any human right now. Keep marching, keep fighting, and also join the Alliance to Reclaim Our Schools. Thank you so much for being on.
Thank you, Kristen. Have a great day.
Thank you. We're going to take a break, but don't go away. We're talking about vaccines, how vaccines actually help our communities and our families according to science, not politics. We'll be back in just a moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by MomsRising. We are joined by one of my very, 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 very favorite guests, Tina Sherman of MomsRising. Woo! Welcome, Tina.
Thank you, Kristen. Great to be here.
I'm so glad you're here because we get to talk about vaccines. There is so much disinformation about vaccines being spread around. I can't even believe it. Can you believe the amount of disinformation?
So much disinformation.
So much disinformation. We live longer, are healthier, and are better as a community when we have access to vaccines. And that's something that we don't often talk about. And I want to share a personal story that's a little bit weird, but I'm going to share anyway. So when my son was born, he had a primary immune deficiency. And because of that, he ended up anaphylactic to eggs, nuts, fish, soy, milk, and more. And then he
Everything.
also was having significant medical issues. A minor cold meant a trip to the hospital. He also, because of his immune system, was unable to get most of the vaccines. Now, if he had gotten pertussis, which is a common vaccine, or any of the common vaccine items, if he had gotten any of those, that probably would have been it for him. That would have been, if he got those illnesses. Mind you, let me just be specific here. If he had gotten the illness that the vaccines were preventing, that probably would have been it for him. Just when he got a cold, he'd end up in the hospital for days, right? So those childhood illnesses are much more severe. And because he couldn't get the vaccines because of what was happening with his immune system, that meant we depended on the community to be vaccinated, right? Yes. The community being vaccinated helps protect people who cannot get vaccinated for one reason or another. And what's also really interesting, having the community be vaccinated helps protect people for whom the vaccine doesn't stick for one reason or another. Not every vaccine is like sticky in every person, right? And it's that community level of vaccination that keeps the community healthy, that then helps people like my son, who was really, really, really sick and would be even more sick. I can't even imagine what would have happened if he'd gotten one of those childhood illnesses for which we thankfully have vaccines. Right? Yes. It's hard to explain because I'm like the most majorly pro-vaccine human. And also we had to, do different vaccine schedule for somebody in my family, also known as my son, who could not. So I don't know, vaccination is complicated, right? It is complicated.
It is.
But community vaccination levels are so important. What are your thoughts?
Well, vaccines are it's so complicated. And I mean, I think the key parts as a part of your and your son's story is, one, following the science, and two, following your doctor's recommendation, which includes following the science.
Yes.
And so those are really critical. And right now, the science is what the science is.
Yes.
However, politics and political grandstanding and misinformation is factoring into the science, the recommendations coming from otherwise regulatory bodies. And that's really scary. That is not what is going to be healthy for our country, and that is not going to be what is healthy for our families. And providing that community, that herd immunity that was so essential for your sons and so many other folks who have other immune compromises or other issues, so critical. And we don't have enough of these conversations about how all of us engaging in what the public health importance is around vaccines. So critical.
So critical. I just Googled. Yes, I love a good Google. And about like how have vaccines helped us with science, right? Using scientific research. So scientific research says that vaccines are the often silent heroes of public health. We can get back to that in a moment because sometimes it's so helpful. You just get one shot and then you never notice or talk about it again. But vaccines are the silent heroes of public health. Not only do they help protect people from everyday diseases, they've also helped to entirely eradicate deadly pathogens like smallpox. In fact, over the last 50 years, vaccines have saved the lives of an estimated 154 million people, according to the WHO. Over 100 million of those lives were infants, like my son. And so I just think that's so important to think about it. And when we think about what is a vaccine, I think that sometimes people wonder about that. So should we talk about that a little bit?
Well, I want to sort of amplify the fact that you went to the World Health Organization. Again, you didn't go to just the random Google WebMD. Want to emphasize that you went to the World Health Organization, which is a world-renowned body providing scientific information based on scientific or scientifically based evidence. Really, 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 really critical that we're getting our information from those key places. And unfortunately, right now, we can't trust the American government and what it's putting out.
I mean,
From the
it's politics.
RFK-led Centers for Disease Control, and that's really hard for me to say out loud as a big advocate of public health. But right now, we cannot trust it is invaded by politics. That is not what science should look like. So I will say that if folks are looking for information, very reliable, very important information, we need to look at folks like the Vaccine Integrity Project that is run by former officials from the CDC that is literally putting out information, scientific information, so that you as consumers can go out and see what is the science and what are the recommendations from other world-renowned doctors and scientists around vaccines. And so the CDC just the last few weeks put out a recommendation to not allow the the hepatitis B vaccine. Incredibly scary. This has been a vaccine for decades now that has been offered, that has been recommended to be offered. I'm not a scientist, so I'm not going to speak to the scientific information specifically, but we'll include in the show notes information from the Vaccine Integrity Project on why the hepatitis B vaccine is safe, has been safe, and it is being endorsed by the World Health Organization, by the Academy of Pediatrics, by ACOG, by the Society for Maternal Fetal Medicine, all of these world-renowned nationally backed scientific organizations that are out here trying to protect moms and babes from very dangerous vaccines. Or I'm sorry,
Very
out here
dangerous
to protect,
illnesses. Very dangerous illnesses.
out here to protect, out here to protect moms and babes from very dangerous illnesses. Woo, this is what I'm grateful you can just exit that out. Scratch that out. Oh my word, Freudian slip.
Well, one of the things that's important is to understand also the science of how vaccines work, because it's not magic, it's science. And I think that is really, really, really important. We've always known through human history that when you get an illness, if it's a significant illness of certain types, you likely never get it again. And so vaccines teach the body to protect itself against specific microbes without taking the risk of a full infection. And how does that work? Well, according to Johns Hopkins University, which is a scientific research center, not according to any kind of bizarre website, the immune system has a wonderful layered system of defenses. And when it comes to vaccines, 2 major defenses are activated by the vaccine in a very good and helpful way. One of them is antibodies, which are proteins in the blood. And then you have something called cell-mediated immunity, which are cells, usually T lymphocytes. You almost always get both from a vaccine, and you can activate those 2 defenses when you come into contact with the illness. And then it basically runs around. I like to think of it like a little Pac-Man. This is no longer Johns Hopkins, it's Kristen. Like a little Pac-Man machine where it's like munching around and eating all the illnesses up, because you've already got kind of the lock and key situation so that you can identify what the pathogen is and your body can just eat it up. So actually, now according to Johns Hopkins, here's what happens. When you get a vaccine shot, the vaccine's in the liquid. It goes through small channels through your lymph nodes where the immune system breaks down the vaccine and learns from the components. It teaches your body what to do. The way to think about it is the vaccine shot is a set of instructions to make both the antibodies and cell-mediated immunity. So if your immune system ever encounters the microbe, it can defend against it. And I think that is really important. It's giving you not enough of the pathogen to make you sick, just enough to protect you from it in the future. It's tested scientifically forever, never. Totally works, right? So this is the science part. Totally works.
Yes.
So anyway, I'm annoyed that the far right is going after vaccines, because literally
Me too.
it has saved so many lives. Vaccination has saved so many lives.
We are stepping back in time, and we absolutely, we here at Moms Rising are absolutely speaking up on behalf of our members and families across the country to share that this is wrong, and we want evidence-based, scientific-based information, not misinformation.
Yeah, so important. So important. Science-based information. I have a little story from a doctor, actually, that I just want to share about the importance of vaccines. Are you ready? Quote,
Ready.
"When I trained as an infectious disease doctor, I used to cover pediatrics and at a hospital in the Bronx. And every week we would have a baby or a young child infected with, I don't even think I can pronounce this, hemophilia influenza type B bacteria. 1/3 of those children died. 1/3 had developmental problems as a result of having meningitis, and 1/3 recovered without any problems. A vaccine was introduced in the early 90s, and I never saw a case ever again." That's like mic drop. Like, nobody wants their kid to, have significant long-term problems or to die from a common illness that could actually be prevented with a vaccine.
I don't know which doctor shared that story, but I think that Dr. Phil Cassidy has shared a similar story on the Senate floor as it relates to the importance of vaccines and the importance of having science guide the policy and not politics. I will note that he was one of the affirming voices for RFK to be sitting where he is sitting now. So we need to hold him accountable. However, I believe I've heard a similar story from him about the importance of the hepatitis vaccine.
Yeah. I can't believe what's happening with politics being played with our vaccines. It's not okay. So the message from me, and I think from Tina too, is listen to your pediatrician. Listen to your doctor. Listen to actual real science. Don't pay attention to those moments when politics are being played with vaccines. And what's your message?
Please check out the Vaccine Integrity Project. Of course, we will again put that in the show notes. They offer real scientific-based information from public health officials who have been in this work for a very long time and are just out here trying to ensure that folks get the care that they need.
Yeah, 100%. And what can people do who are listening right now who want to take action to be like, hello, elected leaders, back to the science, away from the political football?
Yes, please come join us at MomsRising.org and share your story about why public health and vaccines are important to you and why that scientific-based information is exactly what we need.
Thank you so much, Tina, for all you do. Thanks for being on the show today.
Thank you.
We're going to take a quick break, but don't go away. Next up, healthcare. Healthcare is under fire. Why? I ask. Find out in this segment. We'll be back in just a moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined today by a really important guest. We've got Jennifer Haley with the Urban Institute. Welcome, Jennifer.
Thank you so much. I'm thrilled to be with you today.
I'm thrilled to be with you, but also really sad about the topic we're talking about. I want to talk about the Affordable Care Act, which is healthcare, which is also known as the ACA. It's also known as Obamacare. It's also known as the market. It's known as so many things. But what it really is known as is providing increased access to healthcare for tens of millions of people. Right now, we have a moment where Republican leaders in Congress have so far failed to extend the enhanced credits for the ACA, which many researchers are saying could raise the price of healthcare by 70 to 90%. I'm wondering if you could share with our listeners first, before we dive into that, how does the ACA work? What's happening? It's an insurance marketplace, but what is it?
Yes, I would be happy to give you a bit of history. So many years ago, the Affordable Care Act established a few new pathways for coverage for non-elderly people in the United States. That included Medicaid expansion in the states that opted to adopt that expansion, as well as the establishment of these marketplaces, exchanges. As you say, there are many different names for them. So they primarily were a way for people to shop for coverage in a way that was easier for people to access, and also offered subsidies or premium tax credits, which make the coverage more affordable. So the marketplaces were primarily targeted towards adults because traditionally eligibility for Medicaid and the Children's Health Insurance Program has been much more extensive for kids than for adults. And the premium tax credits really helped a lot of people. And then in 2021, Congress extended enhanced the premium tax credits to higher income people and made the size of them larger for the people who had traditionally been eligible for them. That was later extended in the Inflation Reduction Act. And so that's a lot of what's going on in the news these days. You're hearing about these enhanced premium tax credits, which made coverage more affordable for the people who were already eligible for the subsidies and extended the subsidies to a larger number of people. And those are set to expire at the end of 2025. And so people who are shopping for marketplace coverage right now are seeing those premium increases that you mentioned.
And one of the things I think that's really important that we didn't yet mention is that this is healthcare that isn't linked to a job. So as we've seen the rise of job-linked healthcare deficits happening, people in the gig economy, people working in lots of different types of jobs no longer have access to healthcare through their jobs. The Affordable Care Act has been increasingly important for people overall in America. And I'm wondering if before we go a little bit deeper into, what's about to potentially negatively happen, you could talk about the importance of access historically to healthcare that is not linked to a job.
Well, employer-sponsored insurance is the largest, most common type of health insurance in the country, but a lot of people simply don't have access to employer-sponsored insurance. Even if they're working, their employer might not offer it or it might not be affordable. And so what we see these marketplaces filling these gaps. In fact, you are not eligible for subsidies if you do have access to what's called, quote, an affordable offer of health insurance from an employer. And so that's what makes these marketplaces so important, because there are millions of people who don't have access to employer coverage, but also don't have incomes low enough to qualify for Medicaid. And so in terms of enrollment, we've seen really steep increases in enrollment in these marketplaces over the past few years.
So we've got steep increases. We've got a big need, because guess what, people? Everybody gets sick. I've not met a single person who has never gotten sick. It's part of being a human is sometimes you get sick. Also, sometimes you might have an accident, need stitches, or in my case, need a cast. I've broken my ankle. You don't even want to know how many times playing soccer. And so everybody gets sick, and everybody needs a chance to get better, no matter if you're Democrat, Republican, Independent, Libertarian, Green Party. I don't care what political party you are. You're going to get sick, and you're going to need to get better. And yet, we right now have one political party, it's the Republican leadership and Donald Trump, who have not only recently, in what we call the big bad betrayal bill, eviscerated Medicaid, which those are going to have rippling impacts in the years to come because not all of that's implemented yet, but also are about to potentially let expire the enhanced tax credits under the Affordable Care Act. You just wrote a lot about that. What is going to happen if those enhanced tax credits for the Affordable Care Act expire?
So we did a deep dive on the importance of marketplace coverage, specifically for children and parents. I think a lot of people think of these as a program for non-parents. And so we wanted to see how many people are we talking about here that are affected by marketplace coverage and could be hurt by the reductions in the enhanced subsidies. And so we used a couple of national survey data sources, and happy to talk about those: National Health Interview Survey and the Current Population Survey. And we really saw how important marketplace coverage has become for families with children since 2019. So in 2025 and 2024, about 5 to 6% of parents and about 3% of kids had marketplace coverage. And those shares had risen by over a third for parents and over 50% for kids in these last few years. And in fact, kids and parents together now account for about 4 in 10 of all non-elderly marketplace enrollees, according to both these data sources. So this might be surprising to some people. The other thing we found is that reliance on marketplace coverage, especially for parents, does vary across states. And particularly parents living in states that have not adopted the Affordable Care Act's Medicaid expansion, they're really reliant on that marketplace coverage. In fact, almost twice as likely to have marketplace insurance as parents in other states.
I want to double down on something that you kind of alluded to, but I just want to look at it a little bit more. And that is what's really interesting is that a lot of data shows that the states that have Republican representation actually need and utilize healthcare services writ large a lot more than maybe Democratic states, and that there is more money from the federal government going into those states than is coming out to the federal government. And on top of that, some of the analysis that I've seen is showing that the Affordable Care Act coverage costs could go up as much as 90% in rural areas and actually as much as 70% in other areas. Now, it shouldn't be going up that much in any area, but what I'm getting around to is that the people who voted for Donald Trump and Republican leaders in Congress, when you look at the data amalgamated together, are often and usually going to get harder hit by these healthcare cuts than other people. And I'm wondering if you could frame that for our listeners and if your data shows the same thing.
I think a lot of what you're referring to is because of the state decisions on whether or not to adopt the Affordable Care Act's Medicaid expansion, which does tend to be a partisan decision and in many cases. And so what happens is Medicaid eligibility is much higher in states that have adopted the Medicaid expansion. And so marketplace coverage is really important in those states where adults simply don't have any access to Medicaid. In fact, in a state that has not adopted the ACA's expansion, the parent eligibility level is very, very low in most of those states. And if someone is not a parent and they're not disabled or pregnant, there is really no pathway to eligibility for adults in non-expansion states. And so that's why marketplaces are so important in those states, because simply there are no other affordable coverage pathways.
I mean, it's ridiculous. Like literally there are no other affordable coverage pathways. Like I don't even know how to say that enough times so people realize what's at stake. Do you think people realize what's at stake?
I don't know. I really don't know that I think people who are enrolled are now getting those letters telling them what their premiums are going to be and starting to see how unaffordable it might be for a lot of people if those subsidies get reduced. I do see a lot of attention right now to this issue during the shutdown and during the current debates in Congress about the importance of marketplace coverage. So it's helpful to hear that people are seeing what an important coverage source this has become.
Yeah. I mean, at least you're right. At least it is getting a little bit more news, but you know, I wish it was on the front page every day with like giant highlights on top of it, because this is about our healthcare. This is about our well-being. This is impacting people of all political parties. This is really not good. What can people do? Do you have advice on what people can do to help protect and gain access to healthcare?
Well, one thing I would say is right now is open enrollment. And so it's important not just to hear the headlines about how unaffordable coverage might be, but actually go and see what coverage it might be available to someone who doesn't have insurance. The other thing is that I think a lot of people may not know whether they're eligible for marketplace coverage, Medicaid, or something else. So going to state websites, each state has a way that you can access their benefits programs and just see what you might be eligible for if you don't have insurance through an employer.
It's so important. And let's talk about your organization for a minute, the Urban Institute. How can people get involved with the Urban Institute?
Well, we have a really exciting website, urban.org, and share all of our research out there. We are a large organization. I'm in the health policy division, but we have many other divisions looking at different policy areas across the country, different issues related to immigration, affordability, a lot of the policy topics that are really important right now.
And my last question is, well, maybe second to last question, is what's bringing you hope? I mean, this is a little bit hopeless, right? Like, this is really dire. What's bringing you hope as you're seeing all of these dire data points?
Well, I think as I mentioned, the attention to this, I think people are understanding how important healthcare is, especially for kids and families. There's a really large body of research on the importance of coverage for children, the importance of their parents having coverage, on how often they are covered, and whether they're able to access the care that they need.
So, yeah. And how are you keeping going? Like, are you having extra lemonade? Are you running? What's going on? Like, a lot of people are really demoralized looking at the headlines.
This time of year, I'm just trying to bundle up and get outside. It's sometimes hard to do when it's cold, but I think that's an important thing for all of us to do.
Yeah, get a little sunshine in your life.
Some fresh air.
Some fresh air. I was actually, just switching topics, but also kind of healthy, heartened by the fact that chocolate is being seen as being more and more helpful for your actual health. So I'm just diving into that this winter season as we have healthcare on attack. I'm just gonna eat all the chocolate, hot chocolate, cold chocolate, room temperature chocolate. I'm just going with that.
Sounds perfect. This is the season for all the hot chocolate.
Yes, all the hot chocolate. Well, thank you so much for coming on. Thank you for fighting for our healthcare. Thank you for all that you do with the Urban Institute and more. I hope everybody gets involved with the Urban Institute, supports and stays involved with the Urban Institute. And thank you for fighting for our healthcare. I mean, it's so important. So thank you. Thank you.
Thanks so much for having me today. This has been great.
Thank you. Well, that's it for our show today. Thanks so much for tuning in as we tackle the top topics facing our nation in a way that requires the most boring disclaimer in the history of the planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to MomsRising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week.